Hi everyone, I'm Dr. Demchenko with you, and this issue is for runners. I'm going to tell you what to do if you have pain in the periosteal area of the tibia. This condition includes 3 different conditions, which are actually stages of the same process. The first is split shin, or posterior tibial muscle syndrome. This is a situation in which the muscle that controls the foot while running and therefore attaches to the periosteum is clamped. It already gives pain in the periosteum area, and this is a situation that can easily be managed on its own. Inflammation of the periosteum of the tibia itself, this situation already requires some medical intervention, but there are also points that can be treated at home. And the third condition is a stress fracture of the tibia, which already requires direct medical intervention. We'll talk about how to distinguish between these conditions, what you can do yourself, and here we go. When the periosteal pain process is at the stage of posterior tibial muscle pain and tension, most often patients describe the pain in that area as being on the inside of the tibia. If we look at the bones and feel the tibia at our own, here it is. It's a little bit to the back of the tibia. And probing the back of the bone with your finger, you can feel a thickening and soreness. If it's in the lower third of the tibia, that's where the tendons of the posterior tibialis muscle are located, and that's where the most soreness is located. Sometimes you'll see swelling here as well. But we are most interested in the abdomen of the muscle itself. The belly of the muscle is higher. If we look, it will be just behind the tibia, as if under it, which means we need to go a little bit under the bone with our fingers. To feel, first feel the bone, put your finger under the bone, push the calf muscle a little to the side, and press your thumb directly on the bone. Here you will feel a thickening and pronounced soreness. In order to make an effective self-massage of this surface, you need to feel the most clamped area and press hard on it with your thumb. Do not try to move your thumb. Press once, feel a strong pain, and wait. For about 15 seconds, the pain will be quite intense. Then it will begin to decrease. Keep your thumb on the clamp for about a minute. Somewhere after 34-40 seconds, the pain will begin to decrease and you will feel much better already. Next, you need to palpate above and below, the most clamped areas, and choose the most clamped area from those that remain. When you find it, repeat the procedure. You feel the most constricted point again. Turn your finger bone and press down. Again, you wait for relaxation under the finger. Then go over it again and look for more pinch points, usually 2 or 3 in the body area of the posterior tibialis muscle. You don't need to knead in the lower third, where there is swelling and immediate pain in the tendon area, because you won't be able to change anything by kneading that area. If the pain has progressed to the stage of inflammation of the periosteum of the tibia, then the main pain will not be in the back, but directly on the surface of the tibia, right here on the plateau. What are the signs? The first sign is that it becomes lumpy and swollen. It feels as if there is wet, absorbent cotton under the skin, and the soreness will be directly on palpation of the bone. The most common areas of soreness are the lower third of the periosteum and also a small piece in the upper third of the periosteum. Walk around with your finger and see if there are any such spots. If you find such a process already on the periosteum itself, what can you do on your own? First, you can still massage the posterior tibial muscle. Second, you can cool the swollen areas on the periosteum. Third, you can use overnight compresses with 10 times diluted dimexide, Novocaine, and dexamethasone. Fourth, compression during walking or a short recovery run works well. If you find such changes, it is advisable to see a doctor and preferably do an MRI of the tibia. In order to rule out the moment when the process moves to the third stage, namely the tibial stress fracture, which is called a marching tibial trauma. That is, roughly speaking, changes in the structure of the bone itself. How can you suspect that the process has already moved to the bone itself? Quite often the tapping symptom is positive. That is, when you tap on the bone and the pain is not only in the place where your fingers contact the bone, but goes deep into the bone. A second sign may be prolonged pains that don't go away. So it seems that you have already conquered the inflammation of the periosteum. You have completely relieved the spasm. Your leg behaves well when walking normally, but as soon as you start running a little faster or a little longer, the swelling and deafening soreness inside the bone occur again. If there are such signs, you should definitely do an MRI scan and look at it in T2 mode. Usually the description may include words such as bone swelling focus or bone contusion. Very rarely will an MRI write words like stress fracture, because that is a more athletic term. More often you will find words like bone contusion or bone marrow edema focus or edema focus in the tibial structure. If you see these words, you should first remove running activities for at least 3 months, as well as jumping. Without shock loads, you can leave such as cycling, swimming, skiing, roller skating. It is also necessary to drink vitamin D in a sufficiently high dosage, that is, from 5 to 10,000 units for a month, because this is the only drug that is really effective in stress fracture of the tibia. If this tip was useful to you, please like it. It stimulates me to release new videos more often. Write in the comments what you would like to see more of. Bye, everyone.